Welcome to Dr. Jeff Talks About Sex and Intimacy, the podcast where we explore real, raw, and relevant aspects of sexual health and relationships and everything in between. Thank you for joining us today live or on the recording for episode 29, Beyond the Bedroom, What Erectile Dysfunction Reveals About Men's Health. I want to take a moment to sincerely thank you for listening. Your presence here means everything. That's what this is all about. You are the reason the podcast exists. I'm truly grateful for each and every one of you who tunes in. So thank you. We're on social media. We're out there on Facebook, on YouTube, on X, on LinkedIn, on Kick, you name it, we're out there. If you're on X, if you have questions, please go to YouTube, LinkedIn, Facebook, Kick, or StreamYard to allow you to send those questions to us. If you happen to be a Facebook person and are a follower, we'd love you to follow us, because when we get enough followers, we will be able to do, the more followers we get, the more we can do on Facebook. So thank you for following. Go to the website if you want to watch and learn about all the incredible guests who have been on the episodes that we've done starting at the beginning of the year. All the episodes, 28 of them, you can look at them, you can watch them, you can view them. You can view them on YouTube as well and other social media. But the website, it's all there. You can go to the calendar to see what's coming up next week, the following week. We're booked out all the way through October. You can see who's coming and joining me every single week, and I hope you do. So go to the website. Listen to us. We're in your car. We're wherever you are. When you're working out, we're working out with you on Spotify, on Amazon Music, on iHeartRadio. We are there with you. So we are there. Just want to remind you that all are welcome here. Whatever your sexual orientation, your gender identity, or your relationship style, you are so welcome here, and we are so glad you're with us and here to learn. The goal of the podcast is really easy. It's simple. It is to empower you with the scientific, evidence-based information that you need to improve sexual health and to deepen your relationships so you can love and live more fully. Who doesn't want more of that? I'm really guilty of this, so I'm speaking from experience that men are not always so proactive about their health like women are. We tend to be more reactive. Sometimes my wife is like, are you going to go to the doctor and find out what's going on with that? And I'm like, nah, I think it's going to get better. Today, we're diving into a topic that often starts in the bedroom, but its implications reach far, far beyond as we explore how erectile dysfunction, or ED, as it's commonly referred to, is often more than just a sexual concern. It can be a vital sign, a signal of broader physical and emotional health. Joining me is world-renowned urologist and men's health expert, Dr. Tobias Kohler. I have known Toby since he was a resident, and he has made quite a career, and he really is an authority in this area. I'm so glad he's joining us. Together, we're going to unpack what ED can tell us about cardiovascular health in particular, mental health, well-being, lifestyle, even mortality. Whether you're experiencing ED yourself or supporting a partner who is, this episode it's going to offer you insights that could be life-changing, and I hope so. Not just for your sex life, but for your overall health and longevity, because we all need to be more healthy. So my guest this evening is Dr. Tobias S. Kohler. He is an internationally recognized expert in men's sexual and reproductive health. He serves as professor and chair of the Department of Urology at the Mayo Clinic in Rochester, Minnesota. He's a leading clinician, researcher, and educator. Dr. Kohler has authored over 250 peer-reviewed publications and multiple book chapters on topics including erectile dysfunction, penile implants. We've had episodes on that on this podcast. Peyronie's disease. We just had an episode on that with Dr. Levine. And testosterone therapy. We've had several episodes on that as well. He was a lead author on the Princeton 4 Consensus Guideline, which is a lot of the scientific basis for much of what he will be presenting this evening and discussing. Dr. Kohler is a sought-after speaker worldwide and a past chair of the Sexual Medicine Society of North America's Public Education Committee. His research has significantly advanced our understanding of ED and its role as an early marker for systemic health issues such as diabetes, heart disease, and vascular dysfunction. So I am really excited to welcome my friend and colleague and awesome urologist, Dr. Toby Kohler. Hey, Toby.
Hey, how's it going?
Thanks for being here. I so appreciate you sharing your expertise with our audience.
My pleasure, and thanks for having me. Really appreciate the opportunity.
Without further ado, I am going to hand it over to you to begin your excellent presentation. Looking forward to it.
Thanks so much. All right. Well, again, I really appreciate this platform and to talk to your audience a little bit about men's health and the heart. We'll go ahead and go to the next slide. There you go. So whenever we give a formal talk, we're always supposed to talk about our disclosures. So I don't have any current industry disclosures, meaning I don't consult for any companies at this time. I am, however, the current president of the Sexual Medicine Society of North America, and I'm on the board of the American Urologic Association, which is kind of the main organization of urologists in this country. The views in this talk are my own. Next slide, please. So I have two main goals for today's talk. We're going to spend maybe 15, 20 minutes together. One, I want everybody listening to understand the link between the penis and the heart. In essence, penis healthy is heart healthy and vice versa. And then I also want people to understand how lifestyle change can not only benefit your sex life, but your overall health and longevity. Next slide, please. So Peter Attia wrote a book called Outlive, which I'm a big fan of, and he talks about the 4 horsemen of early death. And here in this slide, you can see this Russian painting by Vasnetsov from 1887. And initially, these 4 horsemen were of the apocalypse, were death, famine, war, and conquest. But if you're a human, your most likely causes of death as you get older include heart disease, cancer, metabolic disease such as diabetes, and dementia. So these are the big 4 that you have to avoid. And in short, the 4 horsemen are responsible for 80% of all deaths in people over age 50 who don't smoke. So if we can avoid these 4 things, we're likely going to live a longer, healthier life. Next slide, please. So if I were to ask a fellow doctor or surgeon or even person on the street, if you could only pick one single sign or symptom that would be the best indicator for the 4 horsemen or that they're coming, it actually is erectile dysfunction. This is it's a funny answer, but for men, in order for the erections to work well and the penis to work well, you have to have both excellent physical health and mental health. Without both, it ain't going to work. And another question, which is pretty important to know the answer to, is what is the most common sign or symptom prior to sudden cardiac death? And this is a trick question that you might be asked as a resident or medical student by one of your mentors. And the answer is there is no common sign or symptom. The vast majority of people who just drop dead, they have no prior symptoms. Why is this relevant? Well, it turns out that erectile dysfunction is a prior sign or symptom that can predict sudden death. So let's move on to the next slide. So before I dig in a little bit more into the data and a little bit about the P4 guidelines, which I'll explain a bit, the audience should know that there's been craziness historically for men to get their penis fixed or to improve erections. This is a list of many of the crazy things that people have done throughout history. They've ingested roasted wolf penis. They've melted fat from camel humps and consumed that. Back in the 1920s, people were using goat testicles and transplanting them into humans for fertility. Currently, the FDA keeps a running list of tainted and dangerous sexual enhancement products. And so, people often continue to hope for and believe in this magic bullet to fix their sex life. My main point of showing this slide is A, don't believe, these crazy solutions that you see late night on TV, but B, your overall wellness and health is actually the best way to fix your sexual problems. By focusing on general health strategies, you're actually going to have the best results. Let's move on to the next slide. So a little bit of history. So about 25 years ago, now sildenafil or Viagra was born, and there was an explosion of patients seeking this. They're going to the doctor asking for these pills, and the FDA didn't really know what to do because it really wasn't a well-tested drug. And so it turns out the P4 panel filled this gap where we actually tried to show that these drugs were safe. And I wasn't on this panel, this was 25 years ago, but this first Princeton panel, which is like a collection of urologists, endocrinologists, cardiologists, to try to put their heads together to make sense of the data, they established some important things. Number one, sex is generally safe. So it's pretty rare to die during sex. The risk of sudden cardiac death from sex is 1 per 10,000 person years. And when we talk about the normal metabolic demand or how much energy most people expend during sex, it's the same as 2 to 3 metabolic equivalents or METs. And that's just a unit of energy used in the exercise business, which is equivalent to being able to walk up 2 flights of stairs in 10 seconds or walk 1 mile flat in 20 minutes. So if you can walk a mile in 20 minutes, you're safe to have sex. Now, some people that have a little bit more intense sex, it's 5 to 6 metabolic equivalents, and that is akin to walking on a treadmill briskly for 4 minutes. Next slide, please. So this is a picture from the Princeton 4 panel. So there's been a couple in between, and we printed these 3 papers last year. And if you're interested, you can look these up and read these personally. But basically, we had a couple new findings, which I'm going to share with you today on the stream. Next slide, please. Okay, so you need to know some basic facts and physiology about the penis. First of all, if you want to have excellent erections, you need a couple things to happen. Number one, you have to have healthy arteries. So you can see this cartoon on the left of your screen showing a flaccid and erect penis. You can see those big red tubes in there. Those are blood vessels. And if those get clogged with atherosclerosis or cholesterol, you're going to have problems getting blood into the penis and you won't get good erections. The other thing you need to have good erections is be able to trap the blood in this system. And that's something where the venous system is involved. And anybody who's used a constriction band or a penile ring, they're trying to tighten up those veins and prevent the blood from leaking out of the system. The other thing you have to have for good erections is an intact nervous system. And indeed, adrenaline is very important. Adrenaline is the most powerful anti-erectile chemical we have. So if you're nervous about having sex, or if you're running from a bear, you're never going to get an erection. Because when adrenaline is high, the penis instantly becomes flaccid because the blood is instead shunted to the brain and the legs so you can escape from whatever you're afraid of. And this is the basis for performance anxiety in men who have a bad night and then have continued bad nights because they dwell on the fact that they failed one time. You also have adequate testosterone levels to get good erections. And then the other interesting thing about the penis is it is a use it or lose it organ. If the penis goes in the garage for several months, that is, you're not getting good erections, maybe it's from severe diabetes, or maybe you had a surgery which caused it, a prostatectomy, for example, it's pretty common to lose length of the penis. And so you can help mitigate that by continually having good erections, both actively and in the middle of the night with nighttime erections. Next slide, please. So why is it that I said that the penis is so important in predicting overall health and cardiac health? Well, if you look back historically, Masters and Johnson, they first studied sex in the 60s, and they came up with a lot of interesting theories, but they said that 90% of all problems with erections was psychogenic, or in other words, in the man's head. This is totally wrong. It's actually only 1 in 9, flipped on its head. About 10%, 11% are purely psychogenic. The vast majority of problems are of organic origin. That is to say, there's a problem with the blood vessels, either narrowing or the veins aren't working or the nerves aren't signaling properly. And so most of the time when there's a problem with erections, that means there is some underlying health problems. If we look at the relative size of the blood vessels in the penis compared to the heart and the neck and the legs, the penile blood vessels are the smallest. So because when you get cholesterol in your body and the arteries start to clog up, the blood vessels that are the smallest are affected first. So when you first start having problems with erections, most men will, if they don't do anything about it, and it's a true blocking of the arteries causing the problem, they'll have their first heart attack 3 to 5 years later. They'll have their stroke a couple years after that, and then they'll have pain with walking as the femoral arteries start to become occluded. So this is why the penis is likely so predictive of cardiac events. And indeed, there's many, many trials, which I'll show you in a bit, which show that it's basically a check engine light for your body. And if the penis is not working, you'd have to investigate further. Next slide, please.
Well, I'm not sure. I'm guessing something happened with Dr. Kohler's phone, but we will bring back up his slides and his talk as soon as he joins us again. Somehow he fell out of the call, and so we're glad you're here and learning about this important topic and all the great science and information that Toby is involved with, and he should be back shortly. But maybe you didn't realize how important it is that erections are literally a harbinger. They're a first sign of cardiovascular disease. And Dr. Kohler is probably going to touch on that, but it usually precedes it by about 2 to 5 years. So if there's no definitive cause for your difficulty getting and keeping erections, like you have diabetes or high blood pressure or heart disease already, or things that are known, or spine injury, or whatever that cause may be, it warrants investigation to see, is everything okay? Is your heart okay? Have you had a good physical exam to know that you don't have cardiovascular problems?
Sorry about that, everybody. Can you hear me okay?
Yeah, we can hear you now.
Perfect. Yeah, sorry, I think I'm at home here, as you may have guessed, and I think my daughter's playing Minecraft upstairs, and she took up all the internet space. Anyway, I apologize for the internet problem. So I'll resume where I left off. So basically, this blue table is very busy, but it's basically all the evidence showing that if you have problems with erections, it predicts future medical problems. And in general, men with erectile dysfunction have about a 25 to 150% increase relative risk for heart attacks. If you compare that to known risk factors, it's actually stronger or the same as traditional risk factors like active smoking, having high cholesterol, having a family history. So we truly know that this is a harbinger or a premonition of future bad cardiac events and other health problems. Next slide, please. Okay, so there's actually a new concept. So not only do men who have vascular problems have high risk of heart disease, now we're beginning to discover that men who actually have psychogenic ED, that is problems in the bedroom that come from lack of confidence or depression and anxiety, also have increased heart risk, right? So it doesn't really matter what type of ED you have now. The science is telling us that it's a problem. How can this be? Well, there's this concept called allostatic load, which is when you have stress in your life, whether it's a divorce or a death or switching jobs or whatever it is, you're not sleeping well at night, you release all these fight or flight hormones, cortisol, and that actually leads to early death. So, often you'll hear about somebody whose spouse dies and they die a few weeks later. And this is often related to this allostatic load concept where you get this flood of hormones, which can be negative. Next slide, please. And in general, if we look at the data, people who have higher allostatic load or higher stress in their lives have about 22 higher chance of dropping dead or all-cause mortality relative to people who are more relaxed, do meditation, deal with their stress in a healthy manner, whether that's exercise or whatever it is. Next slide, please. Now, this is a picture from the P4 findings in our Mayo Clinic article, and basically shows this man, and this is supposed to be the same man, both in shape and out of shape. You can see that the guy on the right has a weight, he's lifting, and he's eating an apple, and his heart looks healthy, and he's skinny. And on the left, the guy's eating a donut, he's smoking, and his heart is super enlarged, and there's fat on his heart, and he's obese. And we know that all these risk factors predict not only problems with erections, but a cardiovascular disease. So this guy is setting on a teeter-totter because we can actually use the fact that sexual function is a great fulcrum for lifestyle change to our advantage. So if you start improving your erections by quitting smoking, you also improve your cardiovascular disease. If you improve your erections by losing some weight, having a healthy diet, again, everything gets better. And so it's very important that we remember the foundational things to help with not only the penis, but overall wellness. Next slide, please. So there's a lot of data out there, and I'm not going to belabor the point, but just briefly, these are the 4 pillars that will actually move the needle in living longer, and living longer, not only longer, but living longer well. That is, without disability, where you can have an equal health span, the same as your lifespan. If I could tell you could live to be 100, but you were disabled or were in a nursing home, and you had to have your kids take care of you, you probably wouldn't want that. So what we want to do is behave in such a way that we optimize our health span in addition to our lifespan. And the 4 pillars are stress management, and we talked about the role of allostatic load and how adrenaline is not only bad for the penis, but in too much is bad for us in general. Sleep is super important. If you don't sleep enough, you don't produce the hormones which support your body. And as a matter of fact, if you try to lose weight, if you're on a diet, but you neglect sleep, you will lose weight, but it will be mostly muscle mass. Whereas if you're on a diet and you sleep normally, you'll lose mostly fat mass. So don't forget about sleep, super important. People who don't sleep well die young. Diet and weight control, super important. Everybody knows this to be true. And as little as 10% decrease in body weight typically leads to return of normal erections in about 30% of men. These are guys that need pills to get erections, and they have no chance. They hit the gym, they exercise, they have a little bit of caloric restriction, and they get better. Without pills, they get erections. And finally, there's a lot of data talking about how exercise, both resistance and cardio training, are very important for not only erections, but longevity. So if you average 150 minutes a week compared to nothing, you'll on average have 20% better erections. If you have 300 minutes a week, which is 5 hours a week, so I'm getting 1 hour of workout 5 of the 7 days, you'll have 40% better erections. For men who have normal muscle strength for their relative age, they have a 2/3 lower likelihood of having problems with their penis. So you have to build muscle, you have to keep muscle, and be aggressive to keep your health optimized. Next slide, please. So the P4 findings are directed at physicians, but I want you to just look at the box on the left. And what is the doctor supposed to do? He or she is supposed to ask about ED symptoms as part of their initial assessment. And if there is ED, they should think, well, is this maybe a vascular mechanism? Do they have a history of heart disease? Do they smoke? Do they have high cholesterol? And if yes, they're supposed to do this calculated 10-year ACVD risk score. And this is something you can put into a computer, and it gives you this risk. The bottom line is the vast majority of men above age 50 that have problems with erections will classify as borderline to intermediate risk or higher. And because of that, the new guidelines from P4 says that you should get a coronary calcium score. Now, what's that? That's a quick CT scan, which is pretty cheap these days, $100 to $200, which gives you a real good insight into whether or not you're taking time bomb from a cardiovascular perspective. So the link between the penis and the heart is so powerful now that if you say that you have ED, you should end up getting a coronary CT scan. Next slide, please. Now, if you already have ED and cardiovascular disease, we talked about how it's safe to have sex if you can climb 2 flights of stairs, if you can walk a mile flat in 20 minutes. And this basically gives advice to the doctors as to how, is it safe? What other kind of testing do you do? If it turns out you're a little bit higher risk, often you'll get what's called a treadmill test. And basically you go on a treadmill and they say how well you do. And if you do poorly, you see the cardiologist. If you do okay, it's okay to have sex again. And then occasionally people will want to have sex, but they're on nitrates. in general, nitroglycerin nitrates are not the greatest drug. And so because you can't take PD5 inhibitors, a drug we'll talk about in a bit, along with nitroglycerin, modern day treatments often involve stopping those drugs so that you can actually take the PD5 inhibitors. And the next slide will explain why. So these PD5 inhibitors are fascinating. They're drugs like tadalafil or sildenafil, trade names like Cialis or Viagra. And these drugs have been with us now for 25 years. And for 25 years, we have really strong evidence that they are very safe. Actually, in high doses, they're safe. With different medication combinations, they're safe. We're pretty confident they're good. Not only that, in some countries, they're actually behind the counter, like in England, and in other countries, they're like, you can just get them at any pharmacy. The only reason you shouldn't take PD5 inhibitors like Viagra or Cialis is if you're actively taking nitrates. And like we just talked about, you can often get off that medicine because there's better heart medicines. A funny story, when sildenafil was born, it was tested as a heart drug in England about 25 years ago. And it turns out it was a lousy drug to stop chest pain or angina. But when the patients were asked to send the samples back after the drug trial failed, the patients didn't send the samples back in. Why is that? Well, because the patients quickly realized their erections were better, and that's how Viagra was actually born. In general, when you take these medications, you have to take them properly. And if you want, you can pause the video and read these tips and tricks in this table. But basically, when you use these drugs, you should give them an ample opportunity. When you first try them, you should try them by yourself in a non-pressured sexual situation. You should try them at least 8 different times. And then there's a bunch of other tips here that you'll see, which you can try at home or your doctor can help you with. But bottom line is, about 2/3 of men who have problems with erections, they will have a good response to these drugs. 1/3 of men will not respond, and they'll need other therapies, which we won't cover today, but I'm sure will be covered on future episodes with Dr. Jeff. Next slide, please. Okay, so this is crazy data, which is really eye-opening, which a lot of doctors don't know about. And when we really delved into the data with the P4 guidelines, we felt compelled to put this in the paper. And there are many, many studies which show that men who take PD5 inhibitors, drugs like Viagra or Cialis, consistently have decreased heart attack risk and decreased stroke risk. Remember the story I just alluded to with the Viagra. There does turn out that these drugs probably affect the inner lining of the blood vessels called the endothelium. And if you keep the endothelium healthy in the penis, you get better erections. If you keep the endothelium healthy in the heart, you avoid heart attacks. So this study basically looked at 150,000 or so men, and they compared men who were getting consistent Viagra or Cialis versus not. And the bottom line is, next slide please, that men who were taking more of these medicines consistently had a 39% decreased risk of dying from heart attacks, 22% less risk of unstable angina, 17% less heart failure, and 15% stent procedures. This evidence is so strong that a lot of us in the kind of preventative health community actually look for active excuses to put men on these drugs because we really feel like they have this preventative potential to help men. Now, we're not certain yet. More studies need to be done, and actually studies should be done in both men and women to see if this helps with cardiac risk. But if you have urinary complaints or you have problems with erections, if you get on daily Cialis, it's likely good for your heart. Next slide, please. All right, so I'm going to wrap things up here, and hopefully you've taken these things away from my talk. Number one, the best marker for overall men's health is erectile function. If you take great care of yourself, your penis will take great care of you. There are plenty of men in their 80s having excellent sex life, excellent erections. Why? Because they're healthy. Point number two, doctors should routinely ask you about your sexual function because this is this hidden check engine light, this hidden risk factor, where if they don't ask about it, they may be missing risk for you. But don't be passive when you go to the doctor. If your doctor doesn't bring it up first, you bring it up and say, hey, I've been having problems with sex. Can you help me? And when you do it, be bold. Do it early in the appointment, not when the doctor's hand is on the doorknob, so so that you can get your health addressed. Next, when a doctor does find that you have erectile dysfunction, it's very reasonable for you to ask, hey, do you think I should get one of those coronary calcium CT scores of the heart? Because I heard that it's very predictive if I have ED that I should get this test to see if I'm really at risk for a heart attack. Remember that of all the things we do in medicine, nothing is more powerful than the things we know to be true in lifestyle change. That includes exercise, moving some iron with resistance training, healthy diet, keeping the ideal body weight, getting good sleep, and reducing stress as best you can. Not only will this improve your erections, it will prevent the 4 horsemen of early death like we discussed. And finally, the drugs like Levitra, Cialis, Viagra, these PDE5 inhibitors are very safe and effective, and if taken properly, may prevent heart attacks. And with that, that's all I have to say. I really appreciate your attention.
Wow. Lots of great information, Toby. So timely and so good. It's so cool, the stuff that came out of that report. I mean, it's just amazing. And a lot of things that we've dealt with through our whole careers, right? I mean, we've found that when people get healthier, I think it's hard for people to believe the incredible impact that those pillars have on your life. Stress management, sleep, especially the diet, exercise, weight control piece of it. I know my friend Dr. Mark Moyad has been preaching for years. People are always like, what supplement? What should I do? And he's like, nothing compares to diet, exercise, and weight control when it comes to erection function. So we've all seen it. You know, you've worked with that patient who did exactly what you said, which doesn't happen all the time. We both know often doesn't happen. But when they did, and they got really healthy, I had a guy who lost 43 pounds. He that was his goal. And he's like, I don't even need the pill anymore. Literally, That's how much better my erections are, right? It's amazing how in some people it can make a huge difference.
Yeah, the human body is amazing. I mean, it will adapt to whatever stress we give to it. And at the same time, it will, if you just sit on the couch all day eating potato chips, it will adapt to that lifestyle and you will die young. So, I mean, I can't stress enough. And there's a big movement, in the fitness industry and on YouTube where a lot of, consumers get their health information now. I think muscle is a key thing that a lot of people don't have. And if you start to do resistance training, and I'm talking about both men and women, the changes that you see in your body will not only give you confidence, but you will get stronger fast. And you don't have to go bananas. I'm talking 20 minutes 3 times a week, or even walking for 30, 40 minutes 5 times a week, just briskly. You don't have to set the record, you don't have to set the world on fire, but just getting out there, being active, building some muscle has crazy benefits to cure heart disease, cure diabetes. I mean, all these things we do in modern medicine with pills and stents and surgeries, these are all give us an ability to actually move the lever for real, that is exercise, so that we can actually reverse these things which kill most of us. So, I do like to use problems with erections as a kick in the pants for my patients. And the same holds true for women. So 40% of women will have some form of female sexual dysfunction, right? And you can remember the mnemonic opal, like the jewel. So orgasmic dysfunction, or problems with sexual pain, problems with arousal, and problem with lubrication. These are the four things that women have, that 40% of all women have this form of female sexual dysfunction, one of those 4 things. And indeed, if you're unhealthy, those things are much more common. And if you exercise as a woman, those things will often reverse. Just like in men, the penis will work better when you exercise. In women, a lot of these things will improve as well.
It's so important. And it's so interesting because I spend so much time in my clinic, and have since I began this journey, talking about diet, exercise, weight control, really getting people on that cardiovascular resistance training. And like you said, I tell people 150 to 200 minutes a week. You know, if you do 150, that's 3 50-minute sessions, 5 30-minute sessions. And if you don't tolerate it all at once, you could do 15 minutes in the morning, 15 minutes you could do it whatever way you want. But like you said, I mean, how motivating that when you think, wow, 150 minutes, 20% better erections, 300 minutes a week, 40% better. That's very motivating. And speaking of that, I always laugh because they always say, "Hey, man, Dr. Albaugh, you get more people to quit smoking than anywhere else in the VA." I'm like, well, it doesn't really motivate us men to know that we could die from smoking, but knowing that we're losing our erections from smoking is a huge motivator to get men to quit smoking, because that nicotine vasoconstricts those blood vessels, causes decreased nitric oxide synthesis, and in addition to that, it decreases sensation on the penis. It's an erection killer.
Yep.
In
Absolutely.
Europe, they had those ads with the men smoking, and when the women walked by, the cigarette went whoop like
Yep,
that.
exactly right. And I should have had that on my slides. People who quit smoking, when you quit smoking, it's as powerful in effect as starting medications like Cialis or Viagra. So 2/3 of men will get better erections just from quitting smoking. And actually, I think I wrote for the most quit smoking medication when I was in Springfield, Illinois, of all the surgeons there, because again, I knew it was so important. And as a urologist and men's health specialist, I'm always trying to get my patients to improve their overall health, not just fix the particular problem they're coming in for.
Yes, because overall health, as you said, equals sexual health. Heart health equals sexual health. And erectile health equals heart health. So really good information, really great. And I thought that information was, when I saw that in the studies and everything about the PDE5 inhibitors like sildenafil, Viagra, tadalafil, Cialis, vardenafil, these Avanafil, that they actually can improve cardiovascular health. But that's what they were designed for, so it makes sense. And we both have had those patients who are like really nervous. Oh, I don't know if I should take that drug. It might kill me. I hear people die from that. Well, first off, don't take your friend's drug, listeners. Take it under the supervision of a doctor. I have lots of folks who walk in and say, I tried it, but it was my uncle's or my friends or my... Do it under the supervision of a doctor. But if you do, it's very safe and effective. And now we're seeing research that says it may improve cardiovascular health and actually help you not have cardiovascular events. That is some pretty cool information.
Indeed. Yeah, it's a pretty powerful incentive for a lot of us to start taking it.
Mind blowing. But I think most importantly is those messages: get healthy. Those 4 pillars are huge. And the thing, sometimes stress can be difficult, but the exercise can help with the stress. The diet, sometimes when we're stressed, we eat. But if you really look at those 4 pillars of stress management, sleep, diet, and weight control, and exercise, so important. Got a couple questions for you from the audience. The first one is it ever too early or too late for men to start thinking about sexual health as a window into their overall health?
No, I mean, most of the time, sexual health is the best barometer of overall health we have. Think about it this way. Your body has all these amazing systems which help support our function. But if you start to get unhealthy, what is the body going to sacrifice first? It's going to say, okay, well, reproduction is important, but
Uh-oh. Dr. Kohler froze up. But definitely overall health. I think number one, if you are seeing consistent problems, that it's never too early to go. Now, if it happened once, one specific, very isolated time, then that's probably not so much something to worry about. But if you have seen it happen, and then sometimes once it happens, it makes you worry about it happening again. That anxiety creates adrenaline. Adrenaline, as he said earlier, is part of fight or flight, and it is going to work against your erections. So you don't want to get anxious or think, is it hard? What's it doing? Oh my God, this is where I usually lose it. You cannot do that. Anxiety will make those erections go away. So, and then you don't want to wait. And unfortunately, sometimes we do as men, we wait too long. Early is better than waiting really long to do something about it. So I would say that being a little more proactive about your health, if you see a consistent issue, would be important. Go ahead, Toby. We lost you for a minute, so I was just filling in the gap. This is live. This is how we do it.
I apologize.
It's all good.
Yeah.
Don't worry, man.
This
is the fun of live.
I think we do. It's always better to be be proactive than reactive. And I was getting to the point that if somebody comes to me, let's say with a cancer diagnosis, they're often worried about their fertility, but the body basically sacrifices sperm production in men because it's divesting resources towards healing and towards the inflammation and the cancer itself, right? So that's why your sexual health is such a good indicator. And there's really no time in your life where you shouldn't take it seriously, especially if it's persistent, right? So the definition of erectile dysfunction technically is greater than 3 months of persistent problems with erections of getting or maintaining. So it's normal for men occasionally to have bad nights, especially if they're using alcohol or other drugs, or they're really nervous. It's a first date, or there's a first, things can go wrong occasionally. You don't have to go to the doctor if you have a bad night. However, if it's persistent and it lasts a lot longer than 3 months, or it's just really, really causing a bunch of anxiety, depression, very reasonable to go. But I think, it's okay to give your body some grace, say you're not going to perform at 100% every time. And just because you have one or two bad nights, this doesn't mean there's something wrong with you.
Yeah, and I think that's really important. But two, let's be honest, men know their penis. It's like you wake up from sleep or anesthesia, your hand's down there. Whether it gets hard or not, and it gets hard every day of your life to keep itself in shape. So what it's doing, and when it's not doing what it's supposed to be doing consistently, it's time to go see somebody. Definitely. So. Good advice. Well, you kind of segued into our second question, which kind of asks really, can you explain the difference between psychogenic erectile dysfunction as well as physical erectile dysfunction, and how a provider distinguishes the two?
Yeah, so a big hint about this one is the difference between partnered sex and masturbation, right? So if you're having problems with partnered sex, but your erections are amazing by yourself, that's typically going to be a psychogenic problem, because we know that the plumbing's working just fine when you're by yourself, but now you're throwing the stress and the anxiety of partnered sex, and then that's probably psychogenic. The reality is that most problems with erections have a combination of the two, because once you start to have vascular problems, you start to lose confidence, and then yes, you'll also have some psychogenic components. So it's pretty rare to have the pure psychogenic ED. What does that typically look like? 25-year-old man uses alcohol, has a bad night, and then starts to dwell on that bad night. He produces anxiety every time he's about to have sex. He's like, oh my God, I hope it doesn't happen again. I hope it doesn't happen again. The adrenal glands kick in. They have a fear response. There's no way the penis is going to cooperate. And that's pure psychogenic ED. And that typically is alleviated by confidence. And you get confidence back by giving these men some pills that they know that even if they're a little bit afraid, their erections are going to be 11 out of 10. They get their confidence back, and I never see them again. They never have to use the pills for another 50 years.
Yeah, and that's when you were off for that short time. I was talking about how anxiety is adrenaline. Adrenaline's part of fight or flight. It makes your erections go away. So you have to keep mindful, focused on sex. You cannot worry. You can't go to, oh, this is where I lose it. Am I going to lose it? You don't even have to look down, listener. You're going to lose it. Trust me. What you got to know is you got to keep your mind directed towards, sex, whatever it is that turns you on, but you can't drift over to, is it hard? What's it doing? And especially, oh no, this is where I lose it. So keeping that focus. And remember, you don't need a hard erection to bring your partner pleasure, so you can still enjoy yourself. And then too, we also, along with the pills and different things, each erection you get, because you get erections every day, and that's another way to know if it's psychogenic. Do you wake up with erections when you have to urinate in the morning or at night? Do you have erections because your penis is working out while you sleep? That's an indication that physiologically things are going okay. And then also, every time you get an erection, look down, build your confidence. Your penis is literally looking you in the face saying, I got this, you got this. And that builds back confidence. So every time you get an erection, let it build back your confidence. But when you're having sex, don't let yourself get anxious. That's easy to say, harder to do. But think about, you're having sex. Think about sex, and only sex. Anchor to it's warm, it's wet, whatever keeps you in the moment. But do not drift over to, what's it doing? Oh my God, what's she think about me? This is not going to go well.
Yeah. And, this is a common problem. And in one of the slides where I talked about how to make the drugs work more effectively, sensate focus is an exercise that you do with your partner, which involves touching and not having sex in for several times, so that you build up confidence with this relationship. And there's sex is less about an act, more about something to have fun with. So don't take yourself too seriously in the act. Give yourself a little bit of grace, and often things will get better. It's very reasonable to talk to a counselor about sexual problems. They have a lot of tools in the toolbox. The urologists give pills, they give mechanical devices, but a lot of the long-lasting approaches that men to solve problems with erections come from psychological counseling, sexual therapists. So keep them in mind if you're having these type of persistent issues.
Yeah, Vic, can you put up the ASECT thing for, I'm a certified sex counselor, but there are also sex therapists, and that's the American Association of Sexuality Educators, Counselors, and Therapists. And you can find a great counselor to help you with those things. Earlier too, Toby, I thought it was so important. And I tell people all the time, a lot of men like to try it. When they get the pill, try it on your own. Just think sexual thoughts, stimulate, and see, are you getting harder with this lower dose? Do you need a stronger dose? So when you get in the act, you're confident and know already, I got this pill, I know what dose works. These are things that will help you have the confidence and not be worried so much. And you did bring that up in the talk, and I thought that was really important.
Thanks.
So wow, so much great information and so much good research. And I love all the expertise you shared. I'm going to talk them through a centering exercise, and then we will come back and say goodbye and to everybody. But right now we're going to do what we do on this podcast each time. And we are going to work on getting ourselves a little centered. Yeah, that was a lot of information, and you might be a little overwhelmed, but let's take a moment, like we always do at the end of these podcasts, to center ourselves. After today's important conversation, just center yourself. Get still. Sit in a comfortable position. Let your hands fall to your sides or in your lap, wherever it's comfortable. Take a deep breath in through your nose and exhale gently through your mouth. Fill up your lungs completely, 4 or 5 counts in, 4 or 5 counts out. Keep that breathing pattern. Place one hand over your heart and one over your belly. And as you breathe, feel the rise and fall beneath your hands. Let this be a reminder that your body is always, always speaking to you through your breath, which is so powerful, through your sensation, and sometimes through sexual function. Continue that slow breathing pattern in your nose and out your mouth. Erectile dysfunction isn't just about sex. It's your body asking for care, attention, and possibly change. As you continue to breathe deeply, repeat and know these truths. My journey starts with awareness, compassion, and informed action. I deserve to live a full, vibrant, and connected life. I am worthy of intimacy. I am worthy of love and belonging. I am so much more than my health problems. I am enough. Take a final slow breath in your nose and slowly exhale. Remember, be kind to yourself and those you love. Well, it has been a wonderful episode, and I thank my guest, Dr. Toby Kohler, for joining us and sharing all that great information tonight. Thank you for being a part of this wonderful podcast. Vic, what's coming up next week?
In this episode, Dr. Jeff sits down with Dr. Brenna Moore, a clinical psychologist specializing in couples therapy. Instead of waiting until challenges become overwhelming, Dr. Moore shares practical strategies to enhance intimacy, communication, and connection from the start. Learn how investing in your relationship early on can prevent issues down the road and keep your bond strong and resilient. Whether you're in a new partnership or wanting to deepen a long-term relationship, this episode offers insights to help you thrive together. Join us on July 29th at 7 p.m. Central Time to learn more.
Well, Toby, wow, man, I was thinking about this. How long have we known each other? It's been several decades, wouldn't you say, at least?
Yeah, since 2007.
Oh my gosh. Wow, that's crazy. But anyway, man, I'm so proud of you and all you've done, the incredible body of evidence with all the research you do, all your involvement in Sexual Medicine Society and American Urologic Association, and then the great care you give to your patients. Thank you for all you do and sharing your expertise tonight. You're awesome.
Thank you very much for the opportunity, and let's do it again sometime.
Listeners, thank you for being here. You're what it's all about. We really appreciate you, and have a great one.